Okay. All right. Welcome everyone. So I'm Bailey Bowcutt. I'm a third year PhD student in the Biological Sciences and Public Health program, and I'm studying antimicrobial resistance here at the Harvard T.H. Chan School of Public Health in Yonatan Grad's lab. Today, I'm honored to be joined here by Dr. Sarah Fortune, the John Laporte Given Professor of Immunology and Infectious Diseases, and the Chair of the Department of Immunology and Infectious Diseases, as well as Dr. Yonatan Grad, the Professor of Immunology and Infectious Diseases here, and Dr. Flaminia Catteruccia, the Irene Hines Given Professor of Immunology and Infectious Diseases, and the Director of the PhD Program for Biological Sciences and Public Health. To get us started today, Dr. Fortune will introduce background on the current situation and why we wanted to host this fireside chat for the community. We set this up as a fireside chat as an experiment because we wanted to encourage a conversation between some of our faculty members and our community. As part of that, we wanted this to include a Q&A session. So if you have any questions, please submit them into the chat. And our wonderful Marie Richards will be monitoring this chat for us. We'll have time to ask them at the end. If you would like to ask your question verbally rather than have me read it at the end of this session, please note that in the chat as you submit your question and I will call on you. So now we will have Dr. Fortune give an introduction to the session.
So Bailey, thank you very much. And thank you everyone for joining. Actually seeing everybody's name come up has reminded me exactly of why we wanted to have this, this fireside chat. As all of you know, over the past 9 months, the department and the school have really faced a set of unprecedented challenges as a result of federal actions. And we have received so much support from this community. So we've received support from our alumni, from our science alumni, from our science family, from our family, college friends, friends of the school, and we have been incredibly grateful and buoyed by all of this support. And so we wanted to create a forum whereby we could stay in better connection with all of you and give you a sense of sort of what's happening, boots on the ground right now, and then what we're excited about moving forward. And so that's the goal of today. We hope it is an experiment, but we hope it will be a way to give you a sense of what science at the School of Public Health looks like in this current moment.
Okay, great. To get started, I wanted to start by hearing about how the Immunology and Infectious Diseases Department specifically has been affected. So directed at Dr. Fortune, how is IID navigating this pivotal moment, setting priorities, and looking ahead?
Yeah, so the first major disruption was the loss of our funding. So as many of you know, in the spring, we lost all of our federal funding. So that was something like $24 million annually of funding. That was incredibly difficult and disruptive. And now, after the circuit court ruling about the federal actions, the funding has been restored, at least in part, and we are trying to actually restart. And that is also comes with its own set of challenges. And I guess what I would say out of this has been the discovery that the uncertainty is really destabilizing. And so we have been navigating uncertainty. And through this, our core guiding principles have been the importance of graduate education and our core research mission. And so that is what we've been trying to protect as we move forward. We've been able to do that internally. One of the complexities has been that we, working on the global infectious diseases, are really highly networked globally. And while our own funding has come back, it has not come back in the same shape. And so we've been cut off from our international collaborators. That has been its own set of challenges.
And if I could pick up on that, similarly, it hasn't come back to our collaborators and colleagues at public health institutions, including the CDC and the WHO, where there have been substantial funding and workforce cuts. And it just underscores how the urgency of that work to protect people's health through vaccine policy, disease monitoring and surveillance, emergency preparedness, lab capacity is even greater than before. So I think we now have to look for new partners to support those efforts, building on our work here as scientists and researchers in our efforts for technological and analytical innovation. And it also means we need to find new funding models to really support all of that work.
Exactly. And to expand on this beyond the department, but also looking at the graduate students, I'm curious about the effect this funding environment has had on the graduate students. Dr. Catteruccia, you're the director of the Biological Sciences and Public Health PhD program, the one I'm a part of. So you can see firsthand how this funding cuts affect early trainees as well as those in your lab. So how has this impacted grad students across the program and in your own research?
Yeah, thank you, Bailey, for these questions, and hi, everyone. So as Sarah clearly mentioned, it's been quite a few tough months for all of us. The first reaction was disbelief, frankly, followed by probably sheer panic. And at our school, I would say that the students are probably the most vulnerable populations. They are enrolled in very long programs that last several years, and they need funding to support their stipend as well as the research. So they were very, very worried that this decision by the federal government might mean that they would be forced to stop their degrees. And so really what happened is that everyone stood up. We did our best to reassure our students. I'm very privileged to be the director of this program. We have wonderful students, including Bailey, and we did our best to keep them calm and focused and to show them our support. And our departments were just wonderful in this effort. So our departments committed to funding our students for the duration of their studies, which was such a relief for all people involved. And also, I want to give a particular shout out to our administrators that were put under tremendous pressure to find solutions that were creative on one hand, but also compliant with really ever-changing guidelines. It was absolutely nightmare for them, but they did their best to support us. And so a few months down the line, I would say that the situation is much calmer. There's still anxiety, especially in terms of the future and in terms of job opportunities for students. But we have a very strong network of alumni and donors and funders, so we are very hopeful for the future and optimistic.
And actually, Bailey, it seems like you probably are best super well positioned to give us a sense of what it's been like as a student going through this really unprecedented moment.
Yeah, I have to say, it's been kind of scary, I think, as a student, especially I had federal funding. I had the National Science Foundation Graduate Research Fellowship, so the NSF-GRFP, and it was hard to see that even like individual fellowships were also cut at the beginning of all of this federal funding, and it appears that my NSF has tentatively been returned. But that's just a big whiplash, to have to go through that. And then other things to consider is through the NSF GRFP, there's something called the NSF intern program, which people can use to apply to get your internships paid for, to get a professional development outside of academia. And that's something that looked really exciting, but we're not really sure if that will continue to be funded by the federal government. So all of these things come together to really impact how I'm considering my career development, as well as what I want to do for a career in the future. I think something I've been looking at is having sort of more backup plans, and being like cognizant of what's happening in different fields as I reach closer to graduation. Something I've always been interested in is being a public health lab director, but with cuts to different public health labs and funding, I've been thinking about like having a certificate program that gives me additional verification to work possibly in like a clinical micro lab in a hospital. So that's something that I really have been thinking about, and the uncertainty leads to sort of stress. but I think the Harvard specifically has been really helpful at trying to help us reduce stress and like be prepared to enter into this. But certainly it's something that's a little bit stressful.
Okay, and actually, it's not clear to me that everybody would know specifically where you're from and what the granular details of what you wanted to do. I think it speaks to the program and the range of people who come to the School of Public Health for graduate work. So could you just tell us a little bit more about yourself and what you were hoping that was going to look like?
Yeah, so I'm from Wyoming, and something I'm really interested in is being a public health state lab director. The reason for this is while COVID hit, I was actually in Wyoming, and I got to work in the Wyoming public health labs there. And something that really encouraged me during that period was being able to directly like impact my community with the work that I was doing, being able to help those around me. And I later got to do some research on wastewater for checking COVID and other things, as well as antimicrobial resistance. And then also testing for antimicrobial resistance that could be spread through water systems or through animals in the environment. And so overall, I really love the intersection of public health and research, especially microbial research, with the idea that you can help the most people while you're doing the research that you're doing. So I want to eventually return and do public health lab work as a director, and to apply a lot of the knowledge that I'm gaining here at Harvard to a career to impact others.
Yeah, thank you a lot.
Yeah. Okay, so something else I wanted to talk about was the impact on public health research partnerships. The Harvard T.H. Chan School of Public Health prioritizes making the largest impact it can to improve the health of many. This often includes governmental and international collaborations. This is aimed at Dr. Grad. You mentioned this earlier. What has this meant for your lab and research, these interruptions to these sort of collaborations?
Thanks, Bailey. I would say much of the work that we're familiar with the CDC doing, for example, now needs to be done by local and state departments of public health. And we need to build on our longstanding collaborations with them as they're looking for new solutions. So in our own backyard, there's been a collection of states and state departments of public health known as the Northeast Collaborative, but it's actually now extending down into the Mid-Atlantic as well. And they're banding together to try to replace these CDC activities and figure out how they can enact them locally. So we have to work with them and do what we can to support them. But at the same time, our principles are health for everyone. So we also need to figure out ways to work with people in red states where they may not have the same kind of networks. And that might mean, in some cases, linking with hospital systems or with the private sector of healthcare insurers and providers. But again, figuring out ways to really support the health of all across the country, and then also thinking about this even globally.
I guess that sounds like in any disaster, there's an opportunity.
That's right. I mean, this is a chance to rethink how some of the infrastructure that perhaps was not working as well as we would like it to can be rebuilt. How can we use new methods, new tools to try to approach these questions that are here now and will continue to be pressing in the years and decades to come?
Exactly. And expanding into the idea of international collaborations, Dr. Catteruccia, what do you expect will be the long-term consequences of disruptions to international research collaborations, especially regarding the trust that you've built with those partnerships that you have?
Yeah, most of us here do work on pathogens that are relevant globally and in tropical and subtropical countries, as well as in the north. In my case, I work on malaria, which is a disease that still kills hundreds of thousands of people in Africa every year. So most of my partnerships are with African collaborators, and I've established those partnerships over several years. With initial site visits and then writing grants together, building the infrastructure, training local scientists. So it's been a very long process that is based on common goals of improving the lives of people working in those regions. And obviously the decisions this year by the government to make funding for international research much more difficult to access has put a lot of limitations in our ability to work in those regions, and has really limited our ability to make an impact. So the situation at present is that we are sort of losing the leadership, as actually United States, I would say, are losing their leadership in global health. But fortunately, there are other funders that have stepped up and are starting to fill the gap left behind by NIH. And so they're still allowing us to do research in those countries, and it's making a difference. However, long term, and this is not sustainable, we need to find alternative solutions and alternative funding modes and funding strategies to support that research. The good news is that our partners are still very keen to work with us, are still very committed. They still believe in the impact that we can have, and our students are still going. However, all this is in danger in the future unless we find more sustainable solutions.
And maybe I'll chime in just to highlight the other complexity that is not a Harvard-specific complexity, but the other complexity that has been injected into our international collaborations, which is something that at Harvard is called export control. But what that sort of very banal title encompasses is a series of regulations around the sharing of scientific knowledge across international boundaries. So where one might have once thought that was going to apply to nuclear secrets or something, now we're at a point where there's much tighter scrutiny on the sharing of any scientific information, unpublished scientific information across international boundaries, regardless of domain space. And so for us, that is really complicated to navigate. And one of the things that we're really devoting quite a few resources into building a structure that allows us to maintain dynamic international research collaborations and maintain regulatory compliance.
I'll add another piece here, which is that there are also challenges in having trainees from international sites, so from all over the world, come here to get their training. We have a long history of training the world's leaders in public health activities and in research. They come here, they get their training, they return to their home countries or to elsewhere in the world to then lead efforts there. And that too has become a big challenge in the current environment.
Yeah, actually, I can also add to this because we've seen, sorry, Sarah, we've seen trainees from our partners in Africa that were supposed to come to the United States. They're now afraid of coming to the United States. They are afraid they might be denied visas and entry here, or they're afraid of what could happen to them once they're here. So there is an added complication in our international work that is imposing severe limitations to what we can do.
Yeah. Okay. I also wanted to, although this has been very challenging, and I think there's been a lot of hard parts about all of these funding cuts for us in research, out of these challenges, we have had a little bit of optimism. So despite these challenges, our labs here at Harvard continue to try to push the boundaries of discovery. For example, Dr. Grad's research focuses on communicable disease transmission. And out of some of the cuts to public health, new collaborations have arisen to prevent the spread of disease. Given the importance of these topics, can you speak about collaborations you're excited about or other research questions that you're looking forward to exploring, topics that you are interested in researching more?
This picks up nicely on one of Sarah's comments about in crises, there are opportunities. And I think this is really a prompt for us to link across the university and build on the expertise that's shared across many of our schools. We've got those who think about the impact of climate change and demographic shifts globally, right? We've got an aging population in much of the world, but a rapidly expanding population in sub-Saharan Africa. So how are these going to impact disease risks and transmission? And then we've got people at the business school and centers on communication where we can discuss how do we replicate public health successes like talking about tobacco use or designated drivers or use of seatbelts. How do we do all this in the current media environment so that we can really get the public health messages out to the community and to our population? So I understand the impulse that so many people have to be conservative here and to go into a kind of defensive crouch. But I think this is really an important time to innovate, collaborate, take a look at how we can all work together to prepare for and respond to infectious disease threats.
And maybe I could pipe in and just highlight the importance of new technologies. I think that one could argue that our previous response systems in some instances had become sort of either ossified might be a little strong, but had not fully taken advantage of the new technologies available to us, both sort of biomedical technologies and then obviously AI and computational technologies, that we should be now in this moment of innovation and rediscovery, really bringing to the forefront in terms of creating new efficiencies and new reach that under the old system wouldn't have otherwise been so easy to achieve.
I definitely agree. And speaking about like exciting discoveries, another major focus of our department is on parasite-borne diseases, including malaria, which remains one of the leading causes of death worldwide. Dr. Catteruccia, your research explores the malaria-causing Plasmodium parasite and the Anopheles mosquito. As you've stated before, you aim to provide crucial knowledge to aid the development of new effective tools for mosquito and malaria control. Can you expand on what you're excited about currently or research topics you're hoping to investigate in your lab in the future?
Yeah, definitely. I'm always happy to talk about science for a change. So the exciting news is that life goes on in the lab, and we have exciting results. We are making really important fundamental discoveries on how the malaria parasites survive and develops in the mosquito vector. And so what are the processes and mechanisms that ensure transmission of malaria from mosquitoes to people? And so we are finding the Achilles heels of the parasites, so parasite vulnerabilities that then we can target to prevent the survival of the parasite inside the mosquito, and so decrease the chances of transmission. And to this end, we are generating a completely new strategy for malaria control, which is not based on killing the mosquito with insecticides, as we've been doing for decades, but it's based on rendering those mosquitoes harmless so that they will not be able to transmit the disease. And we've made really tremendous progress in the lab on this strategy. And now we're moving our trials to the field in collaboration with our partners in Africa, as well as also with partners from the private sectors that are interested in moving this technology from just lab demonstration to actual field application. And so this is really what makes me excited for now and in the future as well. The fact that we can use our fundamental knowledge and translate it into tools that can actually be used and improve the lives of people, which is what we all dream of when we start working on global health. So
the lives of people without poisoning all the
thank you, Sarah.
I know mosquitoes are what the world's deadliest animal, and yet
there is another bonus that we would move. We could do without insecticides, which obviously would minimize the impacts on the environment and on people that are sleeping under bed nets covered with insecticides every day. So they're exposed to chronic levels of insecticides, which is potentially not very good for their health.
Actually, one of the things that I don't know that many people fully appreciate is, even though this is a very challenging moment for biomedical sciences, this is in a moment of incredible advance in areas that you would not otherwise necessarily think would be making incredible advances. Malaria is one of them, where there are new strategies for
drugs.
control, new drugs, new vaccines. I mean, the elimination of malaria finally seems within reach. And then in my own area, TB is another one where once again, the integration of basic science, population science, and industry with in a sort of less siloed and linear pipeline, but really iteratively, rapidly moving discoveries forward has been transformative. We're looking at new drug regimens, new vaccines, new understandings of transmission that are transforming TB in a way that you would not have ever imagined 20 years ago would have been possible, and in a cost-efficient manner. I mean, it's totally, cost efficient, but yeah.
And picking up on that as well, is we have issues with antimicrobial resistance, which pose a huge threat to health here in the US and health globally. We are now thinking about in the lab both a basic microbiology of how antimicrobial resistance emerges, but then with the new tools for TB, for malaria, for other drug-resistant infections, how do we best introduce these tools? So we use our skill sets in mathematical modeling and in epidemiology to ask questions about how do we optimize these rare and precious resources that we're now creating. These innovations have huge potential. How do we maximize that? And so these approaches and thinking about how best to roll out new interventions will hopefully, again, expand the reach of these tools.
And actually, to expand on that even further, you can imagine that as a sort of scalable toolkit, which is working to find strategies that are working in TB or malaria, and then scale them into AMR, and then scale them into other disease spaces, trying to think about this as a roadmap for rapid progress, rapid, cost-efficient progress in disease spaces, because really the biomedical pipeline has been incredibly rich, but it has been slow to deliver. And maybe we can, in this moment, envision a way to deliver faster. And actually,
Yeah. I was just going to add on top of that. I think it's interesting to think about the intersection of being able to collaborate between academia and other industries, government, things like that in different scientific areas. And one thing that's been on my mind a lot recently, we have someone in our lab who's very interested in climate change, another graduate student. She makes me think about the intersection of climate change and infectious disease. Also, I just saw someone in the comment ask, what is AMR? That's antimicrobial resistance. That's the idea of like how after a certain amount of time, especially if bacteria have different ways to resist antibiotics. So no longer will treatment work when someone has antibiotics. The bacteria will not be cleared. But anyways, bacteria or other organisms. Okay, so to get into this idea of de-siloing, I think it's interesting to think about infectious diseases, how they've kind of been spreading. And we've already seen this with ticks, especially within, the Northeast. You traditionally think as this being a very like tick-borne area, but I'm from Wyoming. And I remember when I was working at the Wyoming Public Health Labs, ticks were not a thing that I worried about so much as a kid, but we were starting to see way more tick cases than we had ever seen before. Even just like the people in my lab, because we loved going outdoors, and there was someone who was like running around hiking, and he had gotten like 3 ticks in the course of a weekend. And so the intersection of climate change and the spread of tick-borne disease, I think is something that's going to be very interesting. And especially as people start to collaborate more and expand rather than staying inside like academia or staying inside government or industry, I think it'll be really interesting to see how we can impact the spread of these diseases and hopefully fight against this for impacting people across the US.
Okay, I think you have put your finger on like the area in which at least our department should focus moving forward, because tick-borne diseases are obviously our local infectious disease epidemic, and they represent sort of this perfect crystallization of an area of research that has been historically underfunded relative to the burden of disease, and where we can't, spend decades acquiring foundational knowledge before we figure out how we're going to move forward. We need new technologies and people coming together in ways that are previously would not have been easy or supported in order to really rapidly make progress, both in the tick-borne infectious diseases and then the sort of immunologic complexity of tick infections, and especially red meat allergy. I think it is super interesting and super important.
Yeah. Okay. Sorry, Flaminia, I wasn't sure if you had something you wanted to share.
No,
You're
Sarah's
good.
been trying to persuade me to work on ticks for a while. And at some point I'll have to do it. It's just has such a long life cycle that it's like it would be killing a few PhD students in the process. But there are ways that actually we are developing in our laboratory to speed up research in those fields. That is very, very exciting.
Yeah, Sarah's not worried about long doubling times. TB has like an insane doubling time. Okay, so we appreciate everyone taking the time to share with us, and thank you guys for the panel to speak with us on your thoughts. Even when navigating the rough waters of current scientific funding, I believe we can all find something to hold on to by looking to the future and the exciting science we still hope to achieve. I wanted to move on to our community questions. So some people have submitted questions in the chat. Harry also has risen his hand to speak with us. So Harry, would you like to share the first question of the Q&A?
Yeah, great. And sorry to not follow directions, Bailey, but I don't have our chat is disabled, and so couldn't write something. But I think it's great to be back and see everyone and hear all of the great, well, not so great updates, but the way that the community is being resilient through this time. I guess, are there ways that the school, the department, the university is engaging in, I don't call it lobbying or call it advocacy, at the government level? And then are there creative ways for alumni to be involved in that? Obviously I'm not in academia anymore, but my career wouldn't be possible without the training that I received in IID. And I think all of the funding, right, the government funding that makes really all of that run and be possible.
Maybe I'll take that to say, yes, there are intense lobbying efforts. It is unclear to me, though, whether the most productive conversations are held at a federal level as opposed to local levels. And in fact, this is sort of part of creating new ways of doing business. Trying to think about having those conversations with relevant and parties, core constituencies, about how are we going to move forward independent of all of these federal actions. We need a path to move forward that is sort of resilient to what happens in the federal government. I mean, we hope that the federal government will be long-term supportive of research, basic science research, but really we'd like to be moving forward in the disease, making progress against the diseases that we care about or that affect so many people independent of that. And so trying to think about the non-canonical conversations and facilitating those. And for those, our alumni are really important because you're positioned in different parts of business, industry, key stakeholders that might allow us to do things, think about things in a different way, state at the state level. And so that would be extremely helpful to us.
You know how to get a hold of me, Sarah, so anytime.
Yes, but it's lovely to see you.
And I
Thank
would
you,
say,
Harry.
yeah, and I would say, Harry, picking up on some of the things that Sarah mentioned, there are a wide range of things here to support, from the research projects themselves to supporting students. So they're, finding funding sources or even endowing support for a student or for several students or for postdocs, these kinds of efforts can help us reach our mission, both of graduate education, postdoc education, continuing to train the leaders in science, in public health, and those who, like you, move on to other sectors, and to do the fundamental research that really pushes the vanguard, pushes the boundaries of our knowledge and our technology.
I wanted to take our next question, which is from David Cohen. He says, could you please talk about efforts to take the basics to a mass audience not as familiar with the importance of public health research?
Yonatan, I believe this is for you.
I think this is a really important topic, and I think it's evident we don't do it as well as we need to be doing it. And figuring out how we can, I mentioned before, talking with people like at the business school or at areas within the university that focus on communications. Think about how do we pitch ideas? How do we share both the importance and the tremendous impact that public health work, that our research, how do we share the importance of all of this for people's health, both what it has done and what it has the potential to do? So really, I think this is an area that we need to focus on and do better.
I think that's something that I've seen in myself and other graduate students as we've seen the public health cuts or the funding cuts as well, is realizing sort of that like division between how we're communicating and how people are understanding what we're communicating. So a lot of other grad students that I know are trying to work on more like science communication, as well as like working on science policy. Like how can we actually show the work that we're doing and translate it into the things that we want to see be done? And I think it's so important to think about how we, working in public health, the research we're doing is not separated from the people, but should always be integrated with the public in order to have the greatest effect. So that's something that I've been thinking about a lot. And also just trying to communicate more with my like public officials. Something I noticed is like the first time when we got our funding cuts, when I messaged like a government official from Wyoming, is they didn't respond back in a way that like really made sense. I don't think they understood what was happening. And I emailed them again and I made it explain things in different ways. And I think that that really helped them, because when they responded back, I could tell that they understood what I was talking about the second time. And so I think it's a skill that we have to work on, is communicating effectively what the research we're doing is and how big of an impact it will have on our communities.
Okay, and the other part of that might be a little more on us in terms of what we do. Like, I think it's very important that we make sure our research mission is grounded in problems that people see and care about. And in fact, something like AMR, which is terrible that we should call it AMR, antimicrobial resistance, that is a problem that is, in every hospital around this country. They are struggling with antimicrobial resistance, and so those are problems that affect real people all around the country. Ticks, red meat allergy, those are problems that people see and care about. And we should just keep our eye, as I think we do at the School of Public Health. I think we do it, this is our strength, but just keep remembering we're going to work on problems that matter to people and come up with solutions that really help people. And sort of, at least locally, making sure we're clear on that then helps that communication outward.
In some ways, the experience during the shutdown provides an analogy here, in that one of the classic challenges about communicating the impact of public health is see its impact often. In the same way that we've got a whole infrastructure to have planes take off and land safely, right? That was threatened during the shutdown, where they had to actually curtail flights. Same sense of when public health is really working well, people are healthy and they don't necessarily understand all of the efforts that have gone into and continue to go into keeping them healthy. So figuring out how to communicate the benefits there that people really enjoy every day and can look forward to, I think is, again, one of our core mission efforts here.
Next, I wanted to have a question from Nathan Hicks. He said, several of you have mentioned alternative funding models. What do you think are currently the most promising new funding models for public health research? Or put another way, what potential partners are the most promising to convince they should become a funding source in this moment?
Flaminia, do you want to take first crack at this?
Yeah,
And
definitely.
hi, Nate. It's lovely to see you.
Yes, Nate.
Hello.
Hi. Hello. Yeah, for sure. We all mention it because it's something that is on top of our minds. It's one of our major worries. What happens if NIH disappears from our research? That's obviously, we hope that it won't happen, but it's a possibility we have to confront. And so we've definitely been exploring multiple possibilities, both in the private sector and in the philanthropic world. And in our department, I mean, I can speak for myself and for some of my colleagues, we've been quite lucky to have strong philanthropic support for our work on malaria in particular over the years, but in particular in the last year or so, that funding has definitely increased to make do with the deficit that we've seen created by the freezing of our grants. And at the same time, also new partnerships with industry are being developed. And I think that the private sector is also recognizing the extraordinary circumstances that research is going through. And so it's more willing to invest in basic research, which maybe it wasn't happening a while ago, because they realized that they need more to provide more input to basic research in order to advance also the translational aspects that could be utilized in the future. So we have personally been working with industry partners more than before, because they are keen also to help us in our fundamental discoveries, in the hope that what we find will help generate novel strategies. And I think it's the same for other groups in the department and at the school.
Yeah, I think one of the ways to think about this is the short term, who have been really important short-term partners, and then what is a resilient strategy moving forward. And in the short term, although Flaminia didn't mention this, foundational support has also been really important.
Yeah,
So
yeah.
Flaminia is an HHMI investigator, and so that that has been super important. We just had Pardis Sabeti and Christian Happy just won the MacArthur 100 and Change Award, which is $100 million. $100 million. I'll just say that again. $100 million grant to set up infectious disease surveillance throughout West Africa. Those are some of those partnerships are and some of those mechanisms of support are I would say long-term, but many of them are short-term, or not short-term, but represent sort of the intensity of the moment. And for us, the challenge will be trying to figure out how we create a funding structure that sustains the process of scientific development, which is not episodic. Like boluses of funding occasionally are fabulous. We're so grateful. But the real discovery is a sort of slow, steady climb. And so trying to figure out what that structure looks like, I don't think we have a very well-developed model at this point. It will be these new partners and philanthropy. Philanthropy will hopefully be an important part of that.
So we are reaching near the end of our time. I was going to ask, do we want to answer one more question, the pre-submitted question, or would we be like,
Yeah, let's do the pre-submitted question. I mean,
okay.
that would be so bad if they actually
Yeah.
followed instructions and didn't.
Okay, so I'll ask that question. From Dr. Giovanna Poche, how are you shaping training opportunities within the PhD program in biological sciences and public health to ensure that students gain meaningful and practical exposure to international health research environments, especially as global scientific collaboration becomes increasingly essential for advancing public health? And this was aimed at Dr. Catteruccia. Oh, you're muted.
Sorry, there was a train passing by, so I had to mute myself. I was saying that international training, so we are a very diverse program. Different departments are part of this program, and not everyone works on global health. So the access that our students have to international collaborations depends, it's very much lab-based. However, at the program level, we have the opportunity, every student has the opportunity to experience international work if they want to via the internship program. So they can all access laboratories worldwide and do some internships there if they are keen to do so. In our particular department, most of our studies do international work. They go to the field and then spend weeks or months working with our partners there. And this is something that has been always supported by NIH. Unfortunately, now we don't have those opportunities anymore. And so the opportunities are now, unfortunately, just context dependent and lab dependent. And as Sarah mentioned, some labs have foundation support, like my lab, and other labs are, have philanthropic or industry support. And that's something that we would love to harmonize at the departmental level.
Okay, unless I was going to say thank you to the community for your very thoughtful questions. And then we're now open to hearing a final statement and goodbye from our chair.
Well, I was going to actually thank the community for joining us and for the very thoughtful questions and your engagement over this period of time. And then close by thanking you, Bailey, for leading such a fantastic conversation. You always do such a wonderful job, and we are so proud of you in the department. So thank you very much. And thank you all.
Thank you.
Yes, this was a
Bye.
wonderful conversation. Thank you guys for joining us.